Philippine Nurse listeners and followers. Kumusta po kayo? How are you all doing? Well, very well, we hope. And thank you again for joining us today. And as you know, Philippine Nurse is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with PHLV Radio. So there are two topics that people seem to be interested in, these days. It's all about wound care and weight loss. Well, traditionally, wound care healing has been under the aegis of the basic nursing practices, such as, wound covering management, therapeutic nutrition, mobility, and psychosocial support. Nurses have always played a crucial role in handling and managing the acute wounds and chronic wounds. The other topic is weight loss. So there are so many programs out there flooding our social media platforms, and there are many people who are in need of a weight loss program. The public interest is driven by the rising obesity rates and an increased focus on health and wellness as more people become aware of the health risks associated with being overweight. So the demand for effective weight loss solutions continues to grow. So today, we have invited the COO of Image Skin and Wellness Clinic to talk to us about these two topics. So please welcome Ms. Cheryl Maglaya Johnston, right? Hi, Sherry.
Yeah, thank you, Ma'am Doris. Thank you. It's a pleasure to be here today.
Yes, and Sherry is not new to this podcast. She came to us a few years ago talking about her medical mission. So, right? And
yes,
that's still
correct.
going, right?
This was maybe 4 years ago.
Yeah,
Yes.
something like that. So you have changed a lot. You've lost a lot of weight. You look great. And on top of that, I have to let you know that Sherry is from Cabal, La Union, and I am from Bawang, La Union. So we come from the same province.
Yay.
So that's great. And so Sherry is a graduate of the University of East Ramon Magsaysay Medical Center, College of Medicine. She was also, like I said, the official physician of MMLM, which is the Maglaya Medical and Legal Missions, okay, and that's still going on, which is a partner of the Pentecostal Church in the Philippines. And to be able to practice medicine, Sherry took the U.S. medical licensure exam and passed steps 1 and 2 in 2005, but you had a difficulty trying to get your residency,
yes,
right? So you then focused in finishing your master's degree in nursing, and now she's officially a nurse practitioner.
Thank you. Yes, that's correct.
Do you? Well, actually, that was sort of kind of in the past, and now you are the COO of a skin and wellness clinic called Image.
Yes,
right?
that's correct, Ms. Doris.
So do you have anything to add to that?
So, Image Skin and Wellness Center has been in existence since 2014.
Mm-hmm.
So, if Image IMAJ is a palindrome of my daughter's name, I was honoring her then because she's an only daughter.
Mm-hmm.
Okay, and unfortunately, she passed away in 2022 because of glioblastoma. But her memories would live on because of this clinic.
Yeah.
So
yes.
we are offering a lot of services. This is like we are treading on, I would have to say, exciting times.
Mm-hmm.
It's like you said.
Mm-hmm.
The trend now is weight loss, and then of course
Wound
many
care,
things
right?
to talk about.
Right.
Wound care. Yes,
So-
in general.
So your daughter was actually the driving force in creating this skin and wellness clinic, or
Yes.
she was? Wow.
Yes, because
I remember that.
growing up, she was diagnosed with eczema. And it was just so difficult to see her suffer through incessant itching, pruritus, and so therefore I took it upon myself to
Yes.
concoct several things for her, and that actually was the progenitor of Image Skin and Wellness Clinic.
Oh,
Yes.
very good, very good. So tell us about the patients who come to your clinic. What are their most common needs, and what types of insurances do you take?
Our patients are mostly adults, aging between 20 years old and
And
99
above.
years and
Right.
above. And we do family medicine.
Yes.
So that's for our primary care clinic.
Mm-hmm,
And we do hold clinics Wednesdays and Thursdays only. And
Primary care clinic Wednesdays and Thursdays.
Yes.
Okay.
So we have 2 locations, but the one location that we utilize is on Jones Boulevard. The Summerlin location is just dedicated for administrative stuff.
I see.
Yes,
Okay.
and we hold a lot of meetings there, marketing events, and also that's where we market our skin and wellness products.
Products.
Yes.
Okay. All
And
right.
then we do have a home-based program for our wound care
Yes.
and for our pain management.
Okay.
And probably pain management is something that we can discuss
Yeah.
later on. 'Cause-
Maybe later on.
Yes, but
Right.
the wound care clinic, quote unquote, is something that is envisioned by me and some of my partners, that we would be bringing to the home of patients who are invalid, or they cannot
Disabled,
really, yes,
right?
disabled. They really cannot come to the clinic, and and that's saying that we would still be bringing the same quality and accessible care, excellent care, compassionate care, to their home.
To their home. Okay. Yeah. So I was looking up the information at your website, and your services are basically the primary care, right? And then there's pain management. And there's 2 of them, of your services that we're going to talk about today, which is wound care and weight loss.
Yes, that's
Right.
correct.
Okay. Okay. So let's see. Let's talk about wound care. Okay. So there have been like many clinics that have added or elevated their wound care program, right? So what types of wound care services do you actually provide?
So when we added on, first of all, thank you so much for allowing us to speak. Well, I'm speaking on behalf of a lot of nurse practitioners or wound care clinic owners who would really want to clear the air, because there have been so many discussions surrounding wound care in general, right?
Right.
So as far as wound care management is concerned, we do a lot of the traditional, conservative treatment first, because this is following the local coverage determination as prescribed by Medicare guidelines.
Right.
Yes. So when I say LCD, there are different steps that we must undertake in order for us to apply allografts. Allografts, as you may know, is a skin substitute which is derived from the placenta of a pregnant or about to deliver woman.
Right.
And
Right.
So that's the focal point of interest as far as Medicare fraud or wound care management is concerned, because that's where the money is. That's
Well,
that's
true,
how people.
true.
Or that's,
But you guys provide you guys do that service,
yes,
right?
we do that service. But before you get into providing that service, you should have at least done the minimum requirement, or LCD, local coverage determination, that Medicare had
Is requiring.
Yes, had
Right.
required of us.
So for the audience, we need to let you know that Medicare came up with wound care guidelines,
Yes.
which all of the wound care practitioners or clinics, or if you're a facility doing wound care, you have to abide by the laws if you are servicing Medicare or Medicaid patients, correct?
Yes, I just want to clarify that in the state of Nevada, Medicaid does not pay
For wound care.
for allograft
Oh, I see.
application, only
Okay.
Medicare. But in certain states like California, Utah, I think Hawaii, Idaho, there are, I think, 15 states that would allow Medicaid to pay for allograft because
I
they
see.
cost a lot of
Oh
money.
yeah, they
yes.
cost a lot of money,
Yes,
right?
they cost a lot of money, but they work.
Yes,
Yes,
yes.
they work.
And that's the
So-
thing. So I know we can't show you anything like this, but this is the up and coming treatment for wound care. There's a lot of types of wounds. Like you have the active one or the
Yes.
not active, but also chronic
The
ones,
acute
right?
and chronic
the
ones,
acute and
yes.
chronic, right?
Yes,
Can
well,
you
basic-
differentiate that?
Yes. So the acute wounds are basically acute, meaning to say that you know if they were developed or if a wound developed yesterday and you go and see the patient, you would have to label that as an acute wound.
Right, right.
Okay, an infected skin wound or infected wound of the skin, or even a stage 2 pressure ulcer that developed maybe 5 days ago.
Right.
So a chronic wound is something that we would actually be more interested in because it means to say that after doing conservative treatment for at least 30 days,
Okay.
then we can start applying allograft if all the traditional or conservative treatments have failed.
Ah, so what are some of the diagnoses of these chronic wounds?
Very commonly, we do see pressure ulcers.
Pressure
That
ulcers?
progressed from, earlier stages to maybe stage 4. Sometimes we do have deep tissue injury. A lot of times you would see tunneling in the stage 3 or stage 4 pressure ulcers. Mostly in the sacral area because we need to remember that these patients who suffer from pressure ulcers are the ones who are immobile. Yes, so they cannot.
okay.
Yes, and so we do also have venous-like ulcers, diabetes,
Diabetes,
yes,
right?
diabetes, which are very difficult to actually cure and treat.
Right.
And so, and sometimes we see, not very often, we do have skin cancers, but
Okay.
Medicare will not pay for an allograft for skin cancer.
Right, right. So, and you do that, and you also do the regular, like the acute ones and the chronic as well,
Yes,
correct?
we do. We
Okay.
do both. And so a lot of, in my more than 2.5 years of dealing with wounds or wound care in general, we have been very successful at treating maybe 60 to 70% of our patients never get to the allograft application part.
Ah,
So if we are able
good.
to, it's
Yeah.
good.
Yeah.
It's not good for my business
That's
sometimes.
good. That's right.
No, I'm just kidding.
No,
but
it's true.
It's
Yeah.
good because that's what we hope to accomplish. So you get paid by Medicare anyway.
right, correct.
Because you had been able to render service. It's not like it's free or you're not getting reimbursed. You get reimbursed.
Yeah,
Of
yeah,
course.
you do.
And then if that happens, I would have to say it's a trophy for us, Ms. Doris, because our objective here, first and foremost, is to provide the utmost care for our patients.
Correct.
And unbeknownst to many, for those who are not actually paying attention to, or those who are not in the medical field, wounds are very, very painful.
Oh, yes,
Yes.
yes.
You are, the flesh is exposed, and even with the nick, on the skin, and you have a lot of nerve endings there. Very, very painful.
Very painful.
Yes.
Yeah, and then it becomes a challenge if you have, if some of the comorbidities is or the major diagnosis is for diabetes, because then you have neuropathy and the patient can't really feel whether their wound has gotten worse or not, right?
Yes, and that's the real challenge because, especially the wounds that develop, I should say, in the lower extremities. And
Yeah.
if you have diabetes, it simply means to say that you are immunocompromised, oxygenation and of course blood flow is also compromised.
Right,
And
right.
therefore it's just very difficult, to be able to achieve a level of comfort for these patients.
Okay. So the Centers for Medicare and Medicaid actually, like we had said earlier, provides like specific guidelines. What are coverage policies, documentation requirements, and compliance standards for reimbursement, right? Can you talk briefly about this, and is your clinic having any issues on compliance and reimbursement?
We don't have any issues. Well, in the beginning. So so the first 5 months, very contentious because, you know what, it's just like going through a sieve.
Right.
Like documentation-wise, you have a biller, and then Medicare will take a look of everything, like globally, everything.
Oh, yeah.
Yes.
Yeah.
But I think that what we have really accomplished so far is phenomenal in the sense that we are purists. We stand by the guidelines
Right.
from the book, which is the local coverage determination by Medicare. So whenever we see a patient, the first thing that needs to be done is, we have to make sure that that patient qualifies for Medicare reimbursement.
Right, right. Okay.
So now it's as though I don't speak to the level of being compassionate, but as a business owner, it's incumbent upon me to be able to know that not only once or twice that you can help the patient, but through the rest of the time that, that patient needs the help. That's the reason why, insurance eligibility, Medicare Part B, straight Medicare Part B would be tops.
Right.
Now, there are some wounds or patients with wounds. They have what we call Medicare Advantage. They won't pay.
Oh, they won't pay?
They won't pay, but guess what? We would still treat them anyway.
Oh, wow. I did not know that Medicare Advantage plans don't pay for it.
Yes, you would have to fight tooth and nail. Wow. And I'm so sorry. I mean,
well,
maybe I would be very unpopular after this.
No, it's true because, I was just talking to my daughter the other day and she said, why is it that the insurance has to approve everything?
Yes, so it needs to be approved.
It's still an insurance-driven industry, so you're right there. You have to cross your T's and dot your I's, right?
Yes, and then we have what we call IVR, so insurance verification. And so after the eligibility, which is a different step altogether, that's your first step. Insurance eligibility, your biller can take care of it. The IVR, which is the verification part, is undertaken by the distributors of the allograft.
Oh, okay.
So because it has to, so the reason that they're doing that, the distributor side, they need to make sure that this patient has not had any previous allografts.
Oh, okay.
Or if they cannot determine that, at least the manufacturer will take the burden, the brunt, just in case Medicare does not pay for it.
Does not pay for it, really?
So, yes. So you will, between insurance eligibility and IVR, verification, it would take about 2 to 3 weeks.
Wow.
So meanwhile, you would be doing your traditional conservative treatment. So when I say traditional conservative treatment, and we've talked earlier about, the backbone of good wound care management is early debridement. And so, just make sure that you have your surgical instruments and do not forget, the medicated honey. And all the good things that come with it. So very, very important, because in the early parts we have different stages of wound, like wound healing, I should say. The very first one would be the infectious stage, and then you have the proliferative stage, where collagen now grows, to help in the overall regeneration of the tissues. Yes.
Right.
And then the last one would be the restoration or the resolution stage.
Yes.
So
yes.
during the infectious stage, which is about 2 weeks to a month, then you would pray hard, work hardest, okay, so that wound will have a pinkish to reddish, like beefy red granulation look before you can even start applying the allograft.
The allograft,
I
right.
gave you some materials, and I
Yes,
would like
yes.
to show it to you. It's
Here,
yes.
it's right here. But actually, we were talking a little bit about debridement earlier.
Yes.
And I know you have a little bit of a bone of contention about that. And so here in the state of Nevada, nurses are not allowed to debride, only nurse practitioners. But we do have a lot of nurses who are LPNs or RNs, don't have the higher degree and have been doing wound care for forever and a day, but they're not allowed to do that, right? So
And my point being,
Yes.
to your point, that's not fair. Because what can a nurse practitioner do that a nurse cannot do?
Well,
you
it's
are
true.
a nurse first. So nurses went to school, and they also have like a surgical courses, and they were, I mean, and anyone who goes into the practice of wound care would also have some sort of like certification.
yes,
So
yes, correct.
I'm not averse to the statutes here that would state
True.
nurses cannot do debridement.
Yeah.
Even the the conservative sharp debridement.
Yeah.
Anything, any skin that you take off, any skin and some subcutaneous tissues and a little bit of muscle, the nurses cannot do that.
No, the nurses cannot do that because here it's still considered a medical procedure.
Oh.
So anyway, well, perhaps we can change the laws.
Yes, we
So-
have to. Because, okay, I just want you to know that when my wound journey started in 2010, and guess who was responsible for training me? I was a director of nursing in a 200-bed capacity skilled nursing facility. And so one day I was looking for the wound care nurse, and I found out that she's an LVN, but she's a good wound nurse.
Wow.
And I started my wound care journey with that person.
Yes.
Yes. So I don't know. I can't. There's really no rhyme or reason.
Yeah.
But
Well, they're starting now, I guess, because certifications are now mandated if you are going to have to be a wound care nurse, right?
Yes.
Okay.
But even if you're, certified here in the state of Nevada, you would, as a nurse, as a wound certified nurse, you would still not be able to do, conservative
True.
sharp debridement.
Correct. And then they still have to consider the experience behind your wound care
And to me,
person, right?
like I said, I would have to repeat myself. I don't see the rhyme and reason there, because a lot of the nurses that I've come across with have been able to, to work with. They're really tops. They're
Okay.
good nurses. So
All right.
let's do something about it.
Let's do something. Okay, we'll do something about it. But and segueing into that, recently there was a Nevada nurse practitioner who actually pleaded guilty to fraudulently billing Medicare for approximately $14 million for amniotic wound allografts,
Yes.
like you were saying, and that were medically unreasonable and unnecessary. So supposedly Medicare had paid off $9 million out of that $4 million. So, but she pleaded guilty. So this is a very big bone of contention because a lot of nurse practitioners now are doing this. And so what do you say about that? And what's your message to the nurse practitioners who are doing this?
It's okay to get rich, but you have to make sure that you know the rules and regulations, the statutes, and that Medicare has the last say. So why did she plead guilty? I mean, of course she still has a conscience, right?
Yeah.
But when you apply an allograft to an intact skin, that's fraud.
Yeah.
Okay?
Absolutely.
So, does that mean to say that there's no wound? Of course, any even a skin that's edematous, that's erythematous, there's a wound there.
Yeah.
Right? So,
Yes.
lower extremity wounds, you have what we call CEAP classification, and that's probably something that, we should be teaching, new grads or
grads, right.
yes. But the fact remains that was it medically necessary to apply, the graft? If you apply the graft 1, 2, or 3, okay, on a skin that doesn't have an open wound, and you see a difference. Let's say the edema had gone down. There's no pain anymore because this type of wound is very painful.
Very painful, right.
Then you can qualify that's medically necessary because it's doing great job for that wound.
Okay.
I mean, we need to remember that placenta, okay, the amniotic allografts, they contain growth factors. And yes. And so these growth factors, among other things, are actually responsible for promoting granulation, for promoting, lessening of, the edema. But the thing is, it's so hard to pinpoint what went wrong, with this case because she pleaded guilty.
Yeah, I didn't really read up on the specifics of this, but it's in the major news, and so a lot of people are turning, questioning. Okay, she's a nurse practitioner, she's doing wound care, so it's in the back of their mind. But like you said, if you follow the rules, you're not going to be in trouble.
Can you show this a little bit?
Sure.
So that's a stage 4. It's a stage 4 pressure ulcer of the sacrum with tunneling. So this is within a 2-week period.
Wow.
Of doing debridement and doing conservative care.
Wow.
This patient is a hospice patient, and mind you, people are afraid that patients who are in hospice cannot be treated. That's not true at all.
No, that's not true.
Yes.
That's not true.
That's not true at all. This patient died because of pneumonia.
Oh, wow.
Yes, but she actually, if you can take a look at the difference,
yes,
it's like night and day.
It's night and day.
Yes.
And you can see the pinkish regeneration here now of the skin. So wow, Cheryl, I wish we had a lot more time to to talk about this, but perhaps we can do something else later on, a follow-up thing. So, and thank you for the information on the wound care. So let's now talk about weight loss and wellness. Okay. So what current services do you offer regarding this very popular and sought-after issue?
So we do have medical weight loss. And when we say medical weight loss, it encompasses the GLPs, glucagon-like peptides, and the sudden surge of the GLP-1 and the GIPs is because of the fact that FDA had approved them not only for diabetes but also for obesity, and so there are a lot of people who are obese but they're not diabetic, and it has proven to have an significant impact in their weight loss journey. So we do tirzepatide, which is Mounjaro, and then semaglutide, which is Ozempic. So we do compounded versions of those.
You do compounded versions. Well, they recently came up with a pill version, right? Do you believe in that, or is this fairly new, right?
Well, anything can happen, but you cannot bypass gastric you cannot bypass the gastric juices. So still the absorption rate or the amount to be absorbed will not be 100%, as opposed to
as opposed to the injectables, which is like, there's different types now. I know you have Ozempic, you have Mounjaro, and there's Zepbound, I think.
Yes, those are brand names.
Brand names,
yes,
okay.
But they're the same. They're the same ones.
Okay, so I have to ask you this. I was watching the television the other night, and in the news, they were bringing up to the public the awareness of NAION, which means non-arteritic anterior ischemic optic neuropathy. In other words, as a side effect of the popular weight loss drug called Ozempic. In other words, the guy who was presented, actually, he became blind. And the makers of Ozempic really said that this is a very rare side effect of the drug. So what can you say about that?
Other diseases can also
Cause blindness.
Lead to something like this.
Mm-hmm,
It's non-arteritic because the arteries are not really infected or inflamed. It's around the arteries that are, around the arteries. So as opposed to an arteritic type of optic neuropathy.
Okay.
So, diabetes can lead to this.
Can lead to that,
yes.
correct.
So other immune diseases, autoimmune diseases can also lead to this. So I have read, and I have researched about this because I was very much aware of this in the beginning.
Mm-hmm,
and I think that they're saying the reason for the non-arteritic ophthalmic neuropathy is because of the deprivation of blood supply and oxygen in that area. So all too suddenly, that area becomes an area of necrosis. And and so this leads to blindness. You have to remember that the optic nerve, supplies. It subserves for your sight.
Correct.
And so when you don't have blood supply in that area, then that area becomes dead. Unfortunately,
right.
This is not this is
irreversible.
Yes.
Right.
And so
could they have prevented that?
No, don't take Ozempic if you have, if you think that you may have it, but who knows? I don't really know who are candidates for a situation like this.
So there has to be some kind of a comorbidity or a condition that
diabetes
is not in the forefront before they took the Ozempic that they didn't know anything about.
But this is a very rare side effect.
Very rare, yeah.
Yes.
So I just wanted to kind of bring that up because social media is buzzing with all of this stuff. And speaking of social media, have you heard about the pink salt trick?
Yes, we heard about that, but we don't use that. So we don't use that in our clinic.
I am like, oh my God, yeah, because I do need to lose a little weight, right? So everybody like Oprah and Adele and whatnot, they are trying to say, hey, they have this video, and I think they're all fake because they said, I will tell you the formula in about 90 seconds, okay? So 1 hour later into the video, they don't tell you the formula of what you're supposed to drink, but they get you to the site where you have to buy something.
It's Himalayan salt.
Yeah.
Yes.
Himalayan salt,
so
which is the pink salt.
Yes. So they're saying that a little bit of the Himalayan salt, how little it is, I don't know, plus water will give you soul water. SOLE. That's what it's called. So SOLE, soul water. But what people do not realize is that salt, too much of it, can cause a lot of things, like hypertension. You would have water retention. Instead of making you lose weight, I don't really see the wisdom in that. But hey, whatever floats your boat, I guess.
Yeah. So what's the difference between Ozempic and Mounjaro? There,
practically none.
Okay.
A lot of people say that tirzepatide is GIP, which is glucagon insulinogenic peptide.
Okay.
Did I say that right? So what it means is that there's an added layer of protection.
I see.
It's more protective, but it comes with more side effects. Yes.
Okay.
So
all right.
According to my patients who had transitioned from Ozempic to tirzepatide, is that they lost a lot of weight with tirzepatide, but it came with a lot of diarrhea, like everyday
side effects,
diarrhea. Yes.
Right. And they're not cheap.
They're not cheap, yes.
They're not cheap.
Well, a lot of them are covered by the insurances. If you're both diabetic and obese. If you're only obese, your insurance will not cover for it.
And you guys provide that at your clinic?
We provide it as a compounded version.
As a compounded
So
version.
when you say compounded, it is mixed or admixed with a vitamin B12, or in our case, we mix it with L-carnitine, which is a fat burner.
Okay.
Yes.
Well, we sure have a lot to talk about. But, I know time is of the essence here, but we'll have you back and talk about maybe some specific things. But so who are the different staff members in your clinic and the healthcare professionals what are their qualifications?
So, thank you very much. So we have nurse practitioners, we have a medical director and medical consultant. We do have wound technicians who are also certified.
Yes.
So all of our staff, including myself, are all wound certified.
Great.
Yes, and so just to plug in, we have. If you are interested in our services,
yes,
please visit imageskinwellness.com.
Right?
Yes.
Okay.
Image. IMAJ.
IMAJ, and that's what I was going to tell you next. How can they avail of your services? So just go to that.
Yes.
And you have to. So IMAJ. Skinwellness.com. That's your website, correct?
imageskinwellness.com. Yes.
Skinwellness.com. And the phone number is 702-508-6192. And they have two clinics. One is in Park Run, and we could probably bring that up right into our screen. One is in Park Run Drive in Las Vegas, 89145, and the other clinic is in South Jones, 2675 South Jones Boulevard, Las Vegas, 89146.
Yes. So this is our card.
Yes,
Ms. Doris.
We have this, and we're going to show it to you guys.
I think this is the most recent version.
The most recent version.
It now has a cell phone.
Oh.
Yes, so that patients can text.
Oh, you can text now. Okay, so the cell phone is 702-826-0214.
Yes.
Or you can email them at admin@imageskinwell.com.
That's correct.
Okay, very good, very good.
Look for Guada.
Look for Guada. Yeah, Guada is actually here on standby, but she doesn't want to come on the camera.
Look for Guada.
Okay. So, all right. Well, what is your message to the community about skin wellness, wound care, and weight loss? And your clinic, of course.
I went through weight loss. My journey was I would have to say, one of a kind. I did not use Ozempic or tirzepatide. I used the hard way, like really, intermittent fasting and.
I tried that. It's not working.
No, intermittent fasting and, of course, high protein and keto diet. It doesn't work for everyone, but it worked for me. And, of course, a lot of exercises.
Yes.
So for those who are wanting to become wound care providers, the world, the opportunity, there is an open opportunity for everyone. The only thing that I can say is that go to your local nurse practitioner or nursing association, and look for people who can mentor you. So I am very much willing to take on people who would want to be mentored, not only by way of doing debridement. There are many ways to do debridement, but most importantly, the Medicare part of it, because that's you will. Medicare now is targeting every single wound clinic owner.
Wow.
Which they should.
Yes, because, that's good.
Yes.
So, well, thank you so much.
Thank you very much, Ms. Doris, for having me here today. It's a pleasure.
Yes, I'm glad to have you here again after 4 years, right?
I know.
So thank you again, Ms. Sherry Maglaya Johnston, for coming out to our program today, and we appreciate the knowledge that you have imparted to us about wound care and weight loss.
I would like to thank my phenomenal Image team for doing their best every day and for bringing cheer and compassionate care to all of our wound care patients.
Yay!
Thank you. Thank you all.
Thank you very much. And so to our listeners and followers, we leave you with this. So as we have explored today, chronic wounds affect over 10 million Medicare beneficiaries in the United States, with numbers steadily rising. These wounds don't just impact your physical health, they also affect the quality of life and drive up healthcare costs and disproportionately burden other adults in the underserved communities. So with the global rise in diabetes, obesity, and infection, the challenge isn't going away anytime soon. So that's why staying informed actually matters very much. So as healthcare professionals, we have the responsibility to keep up with the latest treatment options, technologies, patient education strategies. And because when we do that, we're just not treating wounds, we're improving lives of people. And with regards to weight loss, it is known that more than half of the U.S. women and over 40% of men are actively trying to lose weight, including myself. And women continue to lead the charge, making up about 65% of the weight loss market. In 2024, actually, women in their 30s and 40s are especially driven, fueled by both health concerns and societal pressures. And men, particularly those aged 25 to 40, are increasingly stepping into the weight management space, now representing 35% of the market. But this isn't just about dropping pounds. It's about building sustainable, long-term health strategies that reflect today's values, where wellness means more than just the number on the scale. And the weight loss industry is evolving very fast, and chronic diseases are growing, and the demand for holistic solutions are there. So clinics like Image Skin and Wellness with the qualified clinicians are a very big help as we move forward. Expect to see more innovation at the intersection of nutrition, fitness, and technology, because lasting change isn't just possible, it's already underway. And remember, wellness is a journey and not a finish line. So, thank you very much for tuning in. Until next time, stay curious, stay compassionate, and keep pushing for better care. This is Doris Bauer, your Philippine nurse host, signing off for now.
This is your Filipino radio experience in Las Vegas. PHLV Radio.